That heart rate has been on its way up.
That's actually the same.
She was
Better than yesterday.
She was 105s consistently.
I mean, it's very easy to make an argument to intubate this woman. A compelling argument to intubate this woman a week ago. It's just that, look, if she gets on a vent, I don't know that her mortality is honestly any better than what her mortality is now.
I think everybody's in agreement, right? Almost 100% likelihood she will die from this.
Yeah.
So now it's just how the best support her and her family through it. And I guess
we all, having gone through this for, close to 2 years, were hopeful that, the rollout of the vaccine was going to help end this pandemic. And locally, because of our local high vaccination rates, and we're fortunate to be in the Metro DC, Maryland area where vaccination rates are high, we felt the benefits of that, and we went down to 0 COVID patients, but I think our window is closing. Although we knew deep down that it probably wasn't going to last forever. When that first patient came into the ICU and needed to be intubated in the vaccine era, it was like a gut punch for all of us.
When you do everything you can to not put them on a ventilator and then they go on a ventilator, oh man, the proportion of those people that survive this disease is extraordinarily low.
And what usually is a kind of lively hustle and bustle to get a patient intubated and stabilized was more of a quiet, solemn ceremony. And having gone through something like that the first and second time, you never want to go through anything like that. And I think that's what's important for people to realize, is the toll that it's taking on society for sure, but the disproportionate toll it's taking on the healthcare providers in the hospital. The vaccination, all modalities of the vaccine are way out of this. You went to see somebody.
Yeah, they were hypotensive, give them fluids.
Okay, not us, no. That having been said, we understand people's choices, but the choices have to be based on data and science and reality. And I think that's the frustration that healthcare providers are having right now, is seeing suffering when it doesn't have to be. Hi, remember me? You're looking more tired. The safest thing for you now is to be put to sleep and put on the ventilator. When faced with the sensation of air hunger and potential death, it's natural for the mind to go to the what ifs. And the obvious first what if is, what if I got the vaccine? What if I didn't have to think about leaving my son or daughter or wife or husband to fend for themselves? And that's the reality that we all see. And it's easy to have opinions about something until you've seen that, and seen that in people's faces. I know you don't want the ventilator, but I mean, what if it was ventilator or death? If it meant saving your life, would you want the ventilator? I think this has to get back to being what it is, and that's a health crisis. It's not about anything more than that. It's not about who you are, or where you're from, or what you believe in, or what you don't believe in. This is a health crisis, and there's ways to deal with it. When you look at it for what it is, the only thing left to do is come together and defeat it. I think that's what's tough about this, is so many lessons learned, yet we're in the same spot. All the experience, all the surges, it doesn't even matter at this point. We're in the same spot.